Hi guys, welcome back to my YouTube channel. My name is Teniola. We are coming across this YouTube channel for the first time. Thank you so much for stopping by. Guys, I know it's been a minute. It's been a very long time I've come on here to, drop a proper sit down video. It's actually been a while. Well, house job was a lot. I am going to do a whole different video about life update and all of that. But what I can talk about today is an ongoing issue. Should I call it crisis? I was just going about my business when I'd been hearing about snake bite killed somebody since over the weekend. So I'm just like, oh my god, that's actually very sad, very very unfortunate. But today now, what even like pushed me to make this video is because I just saw a video online of an interview on TVC. I'm sure a lot of you would have seen the video. I'm just going to put it here now so you can watch it.
Hospital, which is Federal Medical Center, Jabi, Abuja. Apparently, they untied the drip. And they untied the precautions you have put in place, and then they put her on a drip. How do you put somebody whose life hangs in the balance, who could die in a matter of minutes or seconds? How do you put her on a drip? This is the anyhowness of Nigeria.
And that is why I'm saying that we really need to look at negligence or Olamide in our hospitals, because this is one too many times. You go to hospital for something, they're checking another thing. I cannot even imagine somebody has come to you with a snake bite. You should understand as a medical practitioner that you need to tie. So the fact that you're even removing it, does she have malaria? Why are you giving her drip? It's such a sad one, Ibrahim. And when we speak, people will say, oh, why you say Nigeria has failed her? But the drugs were not there. The first hospital she went to, she was sent to another one.
So this video has a lot of, like, the video has just been giving me a headache since morning. Like, since I watched it, I've just been like, what is going on in this country? Like, a lot of things are going on in this country, but now opening your mouth to say things that are not right, or you prove to be knowledgeable about what you are clearly not knowledgeable about, and now bash the people involved. It's kind of sad. Generally, I mind my business, right? I'm not a fan of controversies and dragging and things like that. But this is just very, very wrong in every aspect. I don't know what is hurting me more, the fact that I'm a medical practitioner or the fact that people are actually saying nonsense. So the first thing that caught my attention was when she said, why would you remove the tourniquet? So tourniquet is something that you tie to stop blood flow to a particular side of the body, right? So when snake bites somebody and you tie a rope around the limb or what, like, that's just, see, don't even do that. Sure, you understand? Because you are going to cut blood supply, blood flow to that area, and when you cut blood flow to that part of the body, that's gone is what will even kill the person faster than whatever is going on. So you understand what I'm saying? Because there'll be no blood flow to that part of the body. That part of the body will die. It will go gangrenous, necrosed. It will now start infecting other parts of the body. That you will lose that part of the body, because that part of the body will have to be amputated. And if it is not amputated, it's going to cause sepsis. And when it causes sepsis, the patient goes into septic shock, and boom, the patient is dead. So you come into an emergency room, and that's what the doctor did first. Do you think that maybe the doctor could need brain, or the doctor does not know what he or she is doing? He did the right thing by removing the tourniquet first. Sure, people get what I'm saying. That's that one. Then you now say somebody that will die in a few minutes, how do you put the person on a drip? If I'm to resuscitate a patient, I start from the airway, breathing, circulation, and ABCD, right? The patient's airway is good, the breathing is fine, you go straight to circulation, you cite a line to resuscitate. There's no way you will resuscitate a patient and you will not give an IV into the vein. And when situations are even bad, maybe when the patient has lost blood, lost a lot of fluid, you can't even access the veins, sometimes you have to do central line, sometimes you have to do femoral, sometimes these days now they're even doing interosseous that you have to go directly into the vein, because you have to go directly into the bone because you can't access any vein at the time. It is very crucial. Okay, so the doctor now decided to put drip up. Do you know what is in the drip? Do you know that this antivenom that we are all talking about, how do you want to give it? You want to pour it on the patient's body. Don't you think it will be given? That's why you don't just go and be saying things that you don't know online because you have a platform. I'm very sorry. How do you think the antivenom will be given? It's to be given through drip. So that is probably why that doctor did that. And before we even get antivenom, a patient that has just been bitten by a snake, after securing an IV access, you want to give fluids because the patient could be hypotensive. Depending on type of snake, some of them can make the blood to start clotting and things like that. So how do you want to give fluid? How do you want to give blood if need be? You have to set a line, and if possible 2 lines. In that situation, you don't want to be giving oral antibiotics or oral painkillers. You want to give IV analgesics. You want to give IV antitetanus. You want to give IV antibiotics. And you have to also clean the sites that the thing happened before you now start saying, oh, antivenom, this, antivenom. If I even remember vividly, when we were taught in school that time, what they told us is that they even give it in test doses because people can actually react. Why is it that people are always so quick to bash healthcare workers, this, that? You just come and just be saying all sorts of things about doctors. Okay, so she's saying that something about putting up a drip when the patient clearly maybe has malaria, and putting up a drip when the patient does not have malaria. And in my head, I'm like, in a relationship with malaria, and it's just very, the average Nigerian think that they have malaria and typhoid. So when they come to the clinic, you as a doctor, you're looking at other things. You're checking their vitals. You want to know their glucose. Sometimes you're working with blood pressure of 200 and something, and you're playing on the streets with blood pressure of over 200 systolic. You come into the clinic, your RBG as an individual, as an entity, is over 400, and you think that I'm going to be listening to funny things that you're saying that happened to you 2 years ago in the history. No, now I'm going to face the important thing at that time, which is to correct your blood glucose, so you don't go into HHS and go into something that we don't want, or you don't stroke on that very high BP, and then you now start insulting the doctor for not doing what you actually want. Don't get me wrong, patients there's autonomy. Patients can ask for what they want, as and you have to do it. But even you as a doctor, because in the oath you have to do no harm to your patient, so you do no harm. You guys, it is actually, so I just actually thought about it, that even as a healthcare worker, as a healthcare professional, I can't even afford most of the services that I provide as a doctor. The other day I fell ill, just like 2 weeks ago. My salary had not yet been paid then, and I wanted to run some tests. I knew what was wrong with me, but I just felt, let me have a full picture, just what I would do to a normal patient. You guys, I couldn't afford the test. I had to go back home because I couldn't afford it, and I had to go and treat myself blindly. Just figure it out that okay, this might be what more. I even first went to go and buy albendazole. Albendazole is the warming drug, in case you're wondering. That's what I started with. Let's first start with that. That is how bad it is. If you get to a lot of emergency rooms in the country, you realize that just pray, God, please let Nigeria not happen to me. Let Nigeria not happen to my family members. Let Nigeria not happen to my loved ones. You enter into the emergency room, even the things you need to resuscitate that patient, to keep that patient alive, they are not present. They will say, go and get this from the pharmacy, go and get this from this place, go and get this from that place. They will say, go and get this from this place, go and get this from the pharmacy, go and get this from the store, go and get this from cash points, clinical. All of that going and coming. Patient is there unattended to. You as the doctor, what are you going to do if you don't have the things that you are going to use to treat the patient at the time? Even the way things are going right now, you cannot even help you can't corner for patients anymore, because you can't corner for patients anymore, because even you as a doctor, it can put you in trouble. So many things have happened of recent that doctors are trying to help patients, going out of their way to help patients, breaking protocols to help patients. Eventually, it's you that they will sue. So you know how to wise up. somebody has an accident, needs a CT. You can't access a CT in so many hospitals because no CT, no MRI. There's no lights to maintain these things, no money to maintain these things. So you have to travel all the way to go and get a CT to find the location of the bleed in the person's brain. Before you come, it will rupture. It's just a lot of things. I don't think we need to go online to be bashing doctors who are even going out of their way. At the end of the video, she now said something about she went to one hospital first, then she was sent to another hospital. I'm like, I wasn't there, but what we are taught as doctors is your limit. Once things are looking like, oh, it's already going beyond what you can handle, there are no materials to treat, your knowledge is not, you understand, you refer the patient. Referring is not a sin as for a health practitioner. A health practitioner that even refers you on time even loves you. So you don't criticize doctors for referring patients to other facilities because they feel like, oh, those cases are beyond them. Let those other facilities cater for them. You don't come and bite them because they didn't send the patient away. They referred. And that's a very common wrong notion that a lot of people, they say I should come here, the doctor say I should come here. Please go there. We are poorly paid. We are not, my entire house job salary that I saved. I'm even trying to be serious with you guys. What's wrong with this thing? My entire house job salary, Timo save. I don't know if it can even buy a land. Let's just say I'm trying to be prudent, I'm trying to be responsible. The entire money I need to even stay alive to maintain as a baby girl, I'm not sure my salary is enough. So the little we are doing is God's grace, Psalm 23 verse 1. God's grace, Psalm 23 verse 1, help from our parents and sponsors, and just trying to stay afloat. So this is just another example of the healthcare failing us, the country failing us. Not that you go online and bash the doctor for doing what you believe is wrong, but which was actually right. I don't know if you guys get where I'm coming from. So even as I'm recording this now, phone me is already full because it's Palasa that I'm using. My salary cannot buy a good phone. Right now, I'm recording with Snapchat. Anyways, guys, I really hope that you picked one or two from this video, and I really, this is I'm thinking this is like a comeback for me because I've not vlogged, I've not filmed in a while, I've not edited my videos in a long time. So I guess I'll see you guys in my next video when I'm much more calm and much more articulated, and this country is not giving any one of us a headache. Please make sure you subscribe. Subscription is free, and turn on your notification bell. Bye guys.